Welcome to the office.
Jack, welcome to the office.
Thank you.
How can I help you? What's going on? What brings you here?
Source of it, 95, jumping out of planes for the Army. Injured
Okay.
myself on, one jump in particular, but definitely repetition of that. Anyway,
Training or?
Training, yeah.
Training, okay. What
s-
happened on the jump?
Just high winds, so when you jump out of planes in the military, you don't pull up your risers and land standing up like skydiving. You put your feet and knees together, you hit the ground, you roll. And it was just high winds, so I was kind of going vertically like this. My theory is that I probably just had the right leg a little lower than the left and just landed all the impact in this right leg and just jammed everything up.
Okay. 95.
Yeah.
We're in
So
2022 right now.
exactly.
Okay.
So it's been we're coming up on 27 years of this. And the last 5 years have been a huge, it's gotten really, really bad. But it's been a huge problem. Ever since then, it's been a huge problem. I'm in pain every second, every day. It's mostly in the lower back, the right side, and both the right side and left side pretty intense, more so on the right.
Okay.
But it's kind of gone down the whole, but I've got the hip thing going on, and that's been, so from all the years of just compensating, my whole body's out of whack.
So the right is what was injured. You were compensating to your left side, or you were still doing your thing, like working, living life, so to speak?
Yeah, I was doing, try to live life as best I can, but over the
Okay.
years, so the left side has become a lot worse over the years just because I think of how I walk and
And you've been
work,
compensating on that.
and all that.
Okay. All right.
Yeah. So it just kind of goes on down to the feet, to the knees, everything's just.
Any other injuries
No,
after that?
no.
So talk to me about these surgeries you had.
Hip surgery, first one in 2014. It was actually resurfacing. So it was the VA doctor. They said, because I was kind of complaining about the hip a little bit, and I was hoping it was part of the whole back thing.
Okay.
They recommended this resurfacing process, which
Okay.
made it worse. And then they did a replacement, and then that made it worse because they put the wrong hardware in. So I had to have a third one done,
Okay.
which you say is now pretty good, which is great.
We're gonna we'll go over the X-rays. So on the third one, they did another replacement
Yeah.
because the hardware was incorrect the second
Yes.
time on the second surgery.
Yeah.
Got it. And what about the back? Tell me about the back.
Ended up having a disc removed in the fusion L5 S1.
Why?
It was kind of, of course I had a doctor said yes, I think I can fix it because the disc was completely destroyed. It was just flat.
You could see it.
And yeah, you could see that it was flat.
Okay.
And I was like, to me, it was the next thing. I was like, all right, let's see if it works. So
was
it had
this after the hip replacement?
It was
After the
2015.
third?
It was after the first. It was after the first resurfacing. So it was 2000 hip resurfacing, 2014 back, 2015 second hip surgery, first replacement, 2017,
Okay.
and then this latest one was done in December 2021.
Got it. Okay. All right. We got some work to do, dude. We got some stuff to figure out, actually. Okay. So you had the hardware put in. You've gone through this, and you've gone through many treatments. What kind of treatments now?
Listen, I've done. You remember the VaxD machine? I don't even know if it's still
I do.
around. That was probably 2002. I did that. I was in a place in Chicago, but I did 30 of those treatments. And there's some more rudimentary versions of that. I've done that, but I've probably seen over 50 different chiropractors.
What did they do? What did they find? Anything specific that you were told, like, hey, I'm adjusting your right pelvis, your left pelvis, your L4, because obviously we can't touch L5, S1.
Yeah.
But if there's something down lower in the tailbone, I can work with it. If there's a pelvis issue, I can work with it. I do have a video up where I'm adjusting somebody with hardware and I'm explaining the process and how it is. It's a very different adjustment.
Yeah, the best adjustments it's usually, hey, it feels good. Whatever they do feels good.
Okay.
For 20 minutes and then back normal. The best ones have been when I've gotten someone strong enough to get my SI joint to really, because I think that was stuck for a lot of years.
Okay.
So the best treatments I had was when I had a chiropractor who could get the SI joint and then doing some really intense, like Rolfing, deep tissue work with someone who really knows the body.
Okay.
That combination, when I had that going, it took it from right now I feel like a 7 or at least a 7 pain every day.
Okay.
That kind of took it to a 4 to 5 and a little more manageable.
Okay. All right, so let's see if we can find something. There's one thing I wanted to add, right? Anything can cause anything, and I want to share this quick story with you. There was an episode I was laid out for a month and a half. I had everything adjusted. I had the sacrum adjusted, I had L4, L5 adjusted, pelvis, right side, left side, nothing was working. I went to my mentor with a new set of films up north, one of them. He found a third cervical. He adjusted my third cervical for a week. I'm not saying that's your case, but I'm giving you an example.
Yeah.
I left there, I'm like, Doc, it's still, I mean, it's 40, 50% better, but it's still there. He's like, go back, let them fix that first, then go to your low back. That was my fix. Within the next 6 months, I got 50 cases of sciatica, specific sciatica. We fixed with a neck adjustment. I don't know that that's your case. I'm just saying though.
Yeah.
Okay, that anything can cause anything.
Yeah.
So the purpose of going over this x-ray is just to show you kind of where you're at.
Okay.
Okay? All right, so let's talk about your foundation. This is the right side, this is the left side. This is where we see the hip replacement on the right side. Yes?
Yeah.
And this is where we see the hardware here, where L5 is screwed or fused to the sacrum, S1 specifically. I can actually see stuff down here, which we're going to talk about in a minute, okay? Yes, you have compensated where the left side is wearing out a little bit. You can see that the left pelvis looks maybe slightly lower. Overall, the right side looks slightly higher. But the curve goes to which side? The right side.
Yeah.
So that's not actually consistent with a pelvic SI misalignment. Typically, this is the mechanics. If the pelvis goes down on that right side, okay, then the curve is typically going to be the convexity of that curve is going to be on the low side of the pelvis. Yours is on the high side of the pelvis.
Okay.
So what that tells me is I don't know that that's the pelvis primary in terms of what caused that curve. So whatever injury you had from that diving out of the plane, I think there was an initial tailbone injury. I'm going to show you. Okay. So what I'm showing is this. If you can see it on this, I'm going to change the contrast so we can see. And this is your tailbone here. Okay, sir? You can see it goes like this. It goes like this. It goes like this. Then it bends to the left. And then it bends to the right. There's your initial tailbone injury here. This should be a smooth arc. This nub right here, when I'm looking in here, this is low down. This was one of the initial injuries that started the process. So whatever happened when you dove out, I'm not saying that was it. You did have an injury there, but there was already something going on, not disc degeneration. Because
So how can you tell that was not from the impact of landing and that it happened before?
There's two things going on here, okay? It's not one. I'm looking at, there's this piece here, okay? So it's going like this. It bends in, and then it kind of bends forward here.
Yeah.
Maybe it did, but there's two separate injuries in your tailbone.
Okay.
So whether this one started from the actual dive, fine. There's another one. There's two separate tailbone injuries. It's not one. So whatever it is, my suspicion is, and we'll see it on the exam, we're going to be starting probably somewhere down low, S4, S5.
Okay.
When we look at the numbers, here's what we see. So with the hip replacement, this is the acetabulum up here, but what we're looking at is they're lining up the heads of the femur. And there's only a 1 millimeter measured deficiency from side to side. That's the good news.
Yeah.
So the base of the foundation, there's the level base, level foundation. It's like this. Let's say you're building a house. You get a piece of land. That land should be level. If the land is not level, then we have to alter the foundation. In the body, we don't want to do that. So your land or the base is level. That's good. The foundation is off a tiny bit in terms of the numbers. It shows here we have a slight, this is actually sacrum. The sacrum on the right is rotated slightly back, P2R, and it's down slightly on that side. That's probably what the issue. Can the rotated sacrum come from the fall on the right side? Yes.
Okay.
So remember I was telling you there's two issues that I see there.
Yeah.
The rotation part, that could have been yes from there. Now, so we have the rotated sacrum on the right. It says PI0EX0, so this is not really a pelvis case. This is a sacrum case. Now, the SI joint, follow my process. The SI joint consists of the sacrum and the ilium, the sacroiliac joint. So we're going to the right side now. And when we're looking at the right side here, the SI joint is both pieces.
Mm-hmm.
I'm going to be looking at the sacrum part of the SI joint.
Okay.
Okay? So if this part has gone back, it's going to push that out a little bit.
Okay.
So what we're doing is we'll be pushing, it's either we're starting here or we're starting here.
All right.
Whatever we find on you. It's pushing this forward. Pushing it forward and a little bit of torque to bring it up a tiny bit.
Okay.
Okay? That's kind of the goal there mechanically. All right. Once that's sorted out on the x-ray in terms of what we're seeing, the next question is, okay, so this is fused. We're obviously not touching this area. But what happens when we have any sort of fusion anywhere in the spine, neck, mid-back, low back, then the segments up above become hypermobile and they start moving more than they should. And those can become the next issue. So let's go now to back to the full spine and let's see what we see here. So 4 tilts to the up on the left, takes 3 with it, takes 2 with it, 5, 4, 3, 2, 1 comes back to level, 12, 11. Now this is the fun part here.
Mm-hmm.
Okay, this part here you can see, I mean it's a lot of compression, right? But the discs are still decent there. The issue is here, because you've had that hypermobility or you've had that instability, this thing is trying to, let's zoom in so we can see better. This thing is trying to fuse here, okay? This segment here, so this would be like T11, T10 area, all this stuff here.
Okay.
Then what happens, it kind of switches. This, I have to look a little bit closer at. T1, T2, T3, T4, T5. T5 looks like there was a little bit of compression injury. That could have been from the fall, I don't know. You compressed in like this to the right.
Mm-hmm.
I don't know. But this area right here, this part of the neurological control is the area for digestion. So we have C2 wedged on the left, we have C1 wedged on the right. We call this a critical atlas. So C2 on C3 is slightly wedged on the left, C1 is on the right. If I get an upper cervical pressure, we have to adjust both to balance it.
Okay.
Okay. And then we have some jaw deviation. We can talk about that later. It's not your major reason of being here, but we can talk about it. Your discs in your neck overall are good, okay? 2, 3, 4, 5, 6 is a little bit less. You can see the lipping.
Mm-hmm.
Maybe that could be that, or it could be, if I look at the shape of the disc, it's about maybe a 15, 17-year-old injury when I'm looking at the shape of the disc. Okay, when we're looking at this curve, it looks like kind of like a whiplash almost. Okay. So your C2, your C1 and occiput line should match up. Here's the upper cervical model. So the line going through the occiput on the lateral and the atlas and C2, they should all line up relatively parallel. Your C2 is up like this.
Okay.
That can be putting pressure on the cord. That can also be predisposing the pain that you're feeling down there. Okay? So now that I see this part of it, we're probably going to do something up top. Okay? This is neutral position. In neutral, we're getting overall appearance. Your curve is decent there. Extension is a little bit limited. It looks like you tilt your head back, but in terms of the curve, it doesn't really want to move back as well as it should. In extension, let's see which one doesn't go forward. C2 doesn't really move forward. C3 is kind of still staying there. C4 is back. C5 is back. So they're all kind of stiff. They're not going in that flexed position.
Mm-hmm.
Okay? And the atlas didn't go down. So we have a lot of stiffness, I'm assuming, then, up top.
Yeah, oh, yeah.
Yeah. So everything from here, T10 is over here. Everything from here starts down here. This is all compensating. And then from T10, this is all compensating to the neck. So the mechanics of what I see is something around your T9-10 area, possibly. Definitely down in the tailbone. And we'll deal with the neck as we examine it. Okay, let's get started. Starting at the base, first thing I'm getting, 15 points, left side, C6, C7, 16 points. Five points, left side. Five points, C1, C2, 7 points. I'm following the contour of the spine, so it may seem like I'm going off center, okay? I'm following the contour. A little bit at T6, 5 points. All right, there we go. 10 points, that's around that T10 area, T11, left side. Down low, sacrum, S4, 10 points, right side. All right. Nine, 10 points. So I'm getting the right sacrum, T10, T11, T5, 6, C6, C7, C1, C2 up top. Let's go ahead and now statically palpate and see what we find. Starting at the base of the neck, running my fingers down the spine. And we get to right about here, you can see more of the swelling and edema right there. 1, 2, 3, 4, 5, 6 tender, 7 tender. 6 feels more swollen. Is that tender at all when I push?
Yeah.
You got a high pain threshold, dude. I get it. I get it.
Just
I can
used to it.
I can feel it though. This is squishier. This is more swollen. This is a little bit tender, but it's not as bad as this one.
Yeah.
I'm gonna push harder too. Okay? You feel the difference. 6, 7, 8, 9, 10, 11. Go into extension, please. Put your hands across your shoulders. Cross. Now, we're going to do it this way. Lift your elbows and down. We're going to go into extension, right? So bring your elbows down, round your back.
Okay.
Extend your back, lift your elbows, and down. There you go. 9 is moving okay. 10, 11. 10 is a little restricted, okay, compared, but it's not as sharp as T6 was, correct?
Yeah.
Okay, hands down. Feet together, open and close the knees with your feet touching. Open the knees, close the knees. Open wide, please. Open and close, open and close, open and close. Does that hurt you to do that?
On the right hip groin area.
In the front, correct?
Yeah, so yeah.
Okay. Do the left side only, left side only. So when he does the left, the right is shifting. Now, of course, this is going to shift because of the hardware, but I'm feeling down here. Go ahead and do the left side, please. There's nothing moving down here. Right side only. So when he does the right, this is a little bit more free. Okay. Now, let's check in terms of the Static palpation. Back, or actually, let's check L4 first. Come back slowly. That's 4. 5. So we got hardware up to. Does it hurt when I push on the hardware?
No.
Okay. 5. S1. Okay, that's the screw right there in the middle. S2. S3. S4. Tender there.
Yeah.
Tender more on the right when I push it, or in the center when I push it?
Center.
Yes. Back slowly towards me. It's sharp right there.
Yeah.
S4. He doesn't even flinch, Yasha. So the way we're going to test out between the lower cervical and the upper cervical, it's called DeVoris test. Real simple, okay? I'm going to have you look up at the ceiling. It's isolating the lower cervical spine. We're turning left. We're turning right. So restricted kind of both ways. Does it hurt going either way?
Both ways, more on the left.
More on the left. Head down, please. This is isolating the upper cervical. Turn left. There's actually better movement that way, right?
Mm.
More restricted on the right.
Yeah.
More tender on the right.
Yep.
More tender on the left.
Actually about even on that move.
Okay, now between looking up and looking down, which one hurts more? So when we go down and right, or when we go up and left?
Up and left.
Okay, so that means we got to start on his lower cervical spine. Okay. The right SI joint's not moving, correct?
Yeah.
Sacrum. Keep going, please. And we're going to do one final test to confirm sacrum, okay?
Okay.
And that's going to be a leg check. All right, so the first thing I want us to see here is this. You can see the right leg is slightly longer. This is another good example. When we bend, but here's the cool part. When we bend, it goes shorter. I need you to see the heels first. So let's look here. And you can see the right leg is longer, right? Right there. It's longer here and it bends in. It bends in because it's trying to level off with the left side. When I put them together like this and we bend, it goes shorter. Do you see it shorter on the right side? So what I mean is now it's shorter this way. Okay, and in the Gonstead leg check is the side we're thinking of adjusting. You can sit up for me, sir. I know what we're going to do. So I want to explain this to you. So in the leg check, when we're doing and determining sacrum versus pelvis, the side that's long, if it stays long when we bend the knees, that's pelvis adjustment. Goes short, sacrum. If it's short goes long, that's pelvis.
Okay.
Yours is sacrum.
Gotcha.
Okay?
Okay.
You ready to rock?
Let's do it.
Let's do it. And we're going to do this C6 as a PRI. Means it's gone posterior right. Wedges on the left. Gotcha. Nice and easy there. Look up. Home run. Gotcha. Stand up for me, sir, and just walk that off.
Okay.
You okay?
Yeah.
That actually gave you a little more movement in your right pelvis.
It did. I feel like, so I feel
Tell me
a
what's
lot
the
of
difference.
pressure every time I step, like right here, like kind of hip flexor area or whatever.
Yes.
And I felt that on the right side, and now this feels a lot of pressure, this not any.
It's shifted a
Yeah.
little bit. Good. Keep walking, please. Something's different. Good.
Okay.
We're going to do T6. So your adjustment is actually slightly different than what I normally do. And I'm doing the sacrum actually last in your case. Because once I do that, I don't want to be adjusting anything else on you.
Okay.
Okay? As soon as we do that, we check, everything's clear, you go for a walk.
Okay.
T6 is set as a PL-T. Posterior left, the convexity is on the right side, so I need to get on the right side. 7, 1, 2, 4, 5, 6. So we're on the right transverse. Good. Just like that, sir. Nice. And the way we're gonna set this, we're gonna do it as a PR. I'm gonna be on the right side of the sacrum, down at S4. As I set up, I'm not thrusting until I get the go-ahead from you, okay?
Okay.
I'm just holding there. All right. All right. I need to be down here, sir. Yes?
Yeah.
Okay.
Yeah.
We're coming in on the slight knife edge contact. And the way I'm setting it, I'm not where the hardware's up above, I'm down here. Okay? Right there. Nice and easy. Nice and easy. Good. Nice and easy. Good. Deep breath. And out. Good. Just prepping. Deep breath. And out. There it is. You okay with that?
Yep.
A little bit more. That's it. Okay. Guys, we're not going for it on his first sacrum adjustment, dude, okay? We're setting it deep. It went pretty deep. Let's see what happens now.
It definitely felt, I mean, it was pretty painful getting in there. It was pretty sharp, yeah.
Yes. Walk it off now. And as you're walking, tell me what's different, if anything.
Okay. A little less pressure, I feel, right there.
Okay. So it switched from right to left, and then the left is a little bit less now.
Yeah, and then the right still feels good.
Good.
Yeah, overall, I just feel looser, a little more fluid.
Okay. Yeah, but you know what the test is? The 20-minute walk.
Oh yeah.
That's our test.
Yeah.
I'm okay with that. Don't worry, I'm okay with it. Let's do this now.
Okay.
I'm gonna do the drop board. I want to jar it a little bit.
Okay.
Okay? We're gonna use the drop board over here. Let's go face down back over here. So for the PR, I'm on the right side. I'm on the sacrum part. And I'm just testing the drop board. Okay?
Okay.
And I'm coming down into it this way. You okay with that?
Yep.
2 more. 1 more. There you go. Cool.
Do you feel straight? I feel almost taller, a little bit taller.
Cool. Let's have a seat. Well, your pelvis is actually moving right now.
Okay.
So that's good. Have a seat. Let's retest it. And let's rescope it. Starting at the base. It is different. Good. Neck is clear. Six is clear. Mid back is clear. Oh shit. 10 is clear too. You didn't have to mess with it. All clear down to the crack, sir. No pun intended.
All right.
Feet together. Open and close the knees. Open and close. Both knees. Left side only. Good. Right side. Tell me what's different.
Right side moves a little bit easier than it did before, and yeah, just sitting in this position is not as painful as the other.
Good. Now, let's do the, I call this the buff and polish, okay? This is the vibration. Starting on the back. No issue going over hardware with this, okay? Relax best you can. Let's go on your back and do your ankles. I'll use the drop board. Okay, just tuning up your ankles. Stand up, let's check the hands. Should be a little easier to get up to.
Yeah.
Squeeze. He's so giving me the game face right now. Come over here. He's so giving me the game face. It's okay. It's all good. Squeeze.
Squeeze, all right?
Relax. Elbow. Oof. Relax the scaphoid. Hi, Shasha.
Hi.
How you doing? Okay. Squeeze. Relax there. Lunate. Scaphoid. There. Squeeze. Squeeze. Turn and fish, Shasha. Go do the ears.
Okay.
No defense. There you go. Squeeze. Any questions for today?
No.
Okay, that's where we're gonna start.
Okay.
Water, walking, I'm assuming you drink water, hydrated.
At least a gallon a day. Yeah.
Okay, so you're perfect on that. Okay, welcome to the
Okay.
office.
Thank you.